Welcome, everybody. Today is our second day of Med Talks at ADLM 2025. I'm Jaime Marino, Associate Medical Director for Neurology Medical Research. I am happy to be here and more excited to have our guest speaker, Catherine Price-Snedeker. She is the CEO and founder of PINK Concussion. It's one of the biggest advocacy groups in the United States for brain injury research. She also is an international speaker and a very published researcher. So, Catherine, welcome.
Thank you so much. I appreciate you all being here. I've done talks for 1,000 people, and I've done talks for like 2 people. So I appreciate with everything going on, including puppies and every possible distraction that you're here today. I really appreciate that. My name's Catherine Snedeker. I'm a licensed clinical social worker, and I have started PINK Concussions in 2012 when I was working. Actually, I had a son that had a number of concussions, and I noticed a pattern when I helped people that girls seemed to be taking longer to heal than boys. And I started initially thinking that the parents of the girls were not caring for their girls properly, but the pattern kept showing up. So what I did is start looking at the research and found that there was research behind this and started PINK Concussions to show as initially a website to show the research that had been done. So just to give you a little background, concussions have been studied, brain injuries have been studied since the Roman, the Greek times. If you think of warriors, if you think of the helmet development over time, we've been looking at men and brain injury from a sports standpoint or a military standpoint for thousands of years. But when did we start looking at women and concussion?
Yeah, that is very interesting. I mean, last year we talked about traumatic brain injury, we talked about brain biomarkers. But one of the things that has come up in the research and the different publications is that it has not been looked at it in an equal way. We have focused the majority of the research and the approach of new technologies focused on men. We always look at football. We always look at sport contact. But as we keep talking about it, we notice that this is something that could happen to any of us. In my case, I had a mild TBI, and that's how I started working in TBI research over 10 years ago. Time flies. But it is something that happens to everybody. So one of the things that we've been talking with people like Catherine is that in the early stages of this research, things have not been approached the same way. So Catherine, that's one of the things that I wanted you to talk to us more about the history of the research and how everything started, the good, the bad, the challenges, and what's being done right now to address this huge gap.
Thank you so much. Could we go back just one slide, please? So I asked, when do you think we started studying concussions? The first research with women and brain injury was 1999. That's when they started looking at women. The study was done by a Canadian, Tracy Kavasan, looking at NCAA data. She was a hockey fan, but she thought, what's going on with the women as a hockey player? So it is relatively a very new investigation. The studies in the past were funded by men, usually run by men, on men. And if you want to find brain injury, you could wait on the side of the highway, but you have to wait for a car accident. If you want to find brain injury, you go to football. It's a perfect laboratory for looking at brain injury. So this study, Tracy started this work, and by 2012, there was enough work out there. The American Medical Society for Sports Medicine put out a position statement, and recent data showed that there's more overall brain injury in men and women. More men get brain injury. Men take more risks. They drive faster in general. They have more access to firearms. And up until recently, drink more. Unfortunately, with the alcohol marketing on moms and wine and play dates and that thing, women are now drinking as much as men. This is the first time, so we'll see if there's numbers. Those numbers also come from the emergency room. So the largest group of women with brain injury are not athletes, but women with domestic violence. And they do not go to the emergency room. So if you judged women and men and brain injury and you included those invisible women from domestic violence, there probably is equal. But in the past, we've studied men. So what the research on female athletes showed, that if you had men and women playing the same sport with the same rules, women concuss at a higher rate than men. And you can only do that in a sporting arena where you have the ability to study in that way. So that women concuss at a higher rate, and women report a higher number of symptoms and a greater severity. A lot of the times when you hear people talk about the statistic, they say basically women complain more. But if you go back through the cardiac literature, it's women are more articulate about describing their pain. It's not that we just complain more. The other thing was that there's a longer duration of recovery than the male athletes. So they saw this, but why? Why is this? It was all sort of qualitative, women explaining how they felt. And if you know the history of medicine with women, us complaining about something was seen as qualitative, and a lot of the times, well, women are weaker, women just complain more. Women can't access or have less of tolerance to pain. We needed qualitative, we needed the numbers. And that's really an exciting part for all of you, is because when I started PINK Concussions in 2012, I'm like, I want the lab test. I want the scan. I have to be able to show somebody in a scan or on a lab report why this is happening. I don't want this written off as just women are the weaker sex. So that is the incredible opportunity that we now have that you all are going to be a part of, and it's why are women showing up this way in TBI. Just incredibly exciting.
Yeah.
So what's happened in the last 10 years? This is a review in the British Journal of Sports Medicine. They reviewed 171 concussion studies about the three most influential groups. NATA, again, the American Society of Meds, and it was published in the British Journal of Sports Medicine. So what they found is that even now, 10 years later, concussion researchers leaving women out, even at the highest level in sports. 80% of all of the research, when they looked at it, was done on men. And again, we get back to male funding, to male doctors, to male athletes. And that's where we really need to change that up. And if we want to look at women, could we just do a study with just women? Do we always have to compare to men? Only 1% of the studies had just women to women. So super important. And it's incredibly important because we need this data to be able to improve the outcomes for women and the support and care for women. And that goes from girls to mothers to senior citizens at all different. The mechanism of injury is different than men, outcomes, and the lab results, which we'll talk about. So from a lab perspective, we know that women that are in the luteal phase of their menstrual cycle, where the progesterone is high, if you're injured at that point, you will have a worse outcome and more symptoms. And the thing that they're considering, just water, thing that they're considering is that it's the hypothalamus, pituitary, ovarian axis is affected by brain injury. They also found is that women on birth control or supportive hormones, however you want to call them, would not have that same effect because the estrogen and progesterone was taken orally on a daily basis. And it served as a protector to the brain injury effects. Again, this is all lab-based. And I've gotten to speak to professional coaches about having the menstrual cycle be part of the concussion protocol return to sport. And I've had some real buy-in from coaches that said this will be great. So we will look and see whether women lose their periods or they get a heavier period or whether those changes are. And they're like, I guess we should ask them about their menstrual cycle before they're injured. So again, this is another piece of the puzzle. And again, lab work. Once you have the lab work, you can't kind of write it off as, oh, she's an emotional person. That's why we're seeing this. The other thing that's exciting about lab work is looking at chemical sex differences and neuroendocrine disorders. So the cool thing about neuroendocrine disorders in TBI is that they are something that has a treatment. We don't have a treatment for the symptoms of brain injury. We can't heal brains. We can chase symptoms. But if you have a TBI that is then giving you a endocrine disorder, we can treat that. We do the lab work, we find out what you need, and we prescribe that. So there are people walking around with symptoms of TBI right now where they're like, oh, I have this because TBI, but it's developed into an endocrine disorder, which we can treat, and that's the exciting part of that. Again, back to lab work. The US Army, after a TBI, moderate to severe TBI in males, at a 1-year part, they'll do a full endocrine panel for men to see where they are. But it fluctuates so much in that year. That's kind of where the Army is, the military is doing it right now. Another lab-based study in concussion was this one done in Arizona at Pediatric Traumatic Brain Injury Disorders. And what they did is they looked at chronic anterior pituitary deficiencies after TBI. And they found that in 15 to 16% of the adults and 42% of the children, they would see, again, pituitary deficiencies after TBI. But what about women? So when they took the data and they went back through and looked at it, they found that females, 64% to 35%, were showing these deficiencies after TBI. I have a YouTube channel, just a little plug there, and I interviewed the researcher who goes really into depth in this. Really interesting study. So again, the last 15 years, I've gone up to researchers and said, I love your study on men. Have you tried it in women? No. And same party trick, I've gone to researchers that have men and women and said, you just gave me N. Have you looked at male versus female? For NIH grants, you have to have women in your studies or explain why you didn't use women or female animals. You don't have to give the results on the back end. So even though we're including women in these studies, we aren't showing the results on the back end. You also have to check, too, especially in the rodent studies, make sure that the female rodents didn't have their ovaries taken out. And the reason why female animals weren't used in the lab work, right, because we could get male and female rodents easily, is because that they found that the female rodents with their estrial cycle, which I think is every 6 days, would throw off the results. So that was seen as a barrier to research, not as a sex variable that they wanted to study. So in that reason, they either took the ovaries out of the female rodents or just used male rodents in general. So here's this pediatric TBI endocrine function by sex, and that girls earlier and had longer recovery periods compared to the males. So we've been talking about sex differences was from a genetic standpoint. The other thing I wanted to see is, when is a scan going to show this? And since you're lab people, I'll go a little faster through this. But this is Doug Smith's work. And so what they did is, in the neurons, in the brain, this sort of Lego building component, and by the way, I love the Lego display over there. I'm a huge Lego fan. But the little pieces, you can think of them like building blocks, are nanotubulars. So what we're looking at is a male and a female human. It's also the same in rodents. If you took one of those axons and you cut it in half and you're looking at it, and so those strands are called nanotubulars. In the female, they are more slender and there are fewer of them. So if you had a rope and you had fewer strands, it's not going to be stronger than a heavier rope. So these are the physical differences you can see in the nerve cells in the brain. So what happens in traumatic brain injury is it's a shifting. It's a lot of cartoons show the brain bouncing like this, but it's a shifting. And so those nanotubulars are running by each other. With the female, there's more breakage than the male just because of the structure. And the sodium-potassium gateway makes it a more chronic situation. Basically what they describe it as a pathological soup. So from a structural standpoint and from a chemical standpoint, women are faring worse than males. So those are some of the highlights. And again, it's that women are faring worse and take longer to recovery. So now we have the lab component to show that, and then we also have a functional MRI.
Yeah, great. Thank you so much. And I think one of the main things that are happening right now is some of you might already be aware of this, but 2 months ago in May, the Lancet Neurology just published the new nomenclature, the new framework for the classification of traumatic brain injury. That perspective of mild, moderate, and severe is going away. Because as Catherine was as very passionate about, we know that traumatic brain injury is more complex. It's a very heterogeneous pathology that we cannot look at it anymore from what we see in the emergency department. We have to look at everything. We have to look at the clinical aspect, biomarkers, which is something that we are very excited about because we were the first company that had the TBI test for clinical practice for a completely different indication, but it is something that different medical associations have acknowledged that these biomarkers will play a role in the future. And number two, imaging. Imaging is not going to go anywhere. And most importantly, and this is where everything that Catherine is talking to us about, the modifiers, where socioeconomical factors, the fact that whether they have insurance, whether they have risk factors, medical history, risk behaviors that they have, all these aspects now have to be taken into consideration when physicians assess those patients in the emergency departments. And that's in the past was very the moment, oh, is it a male or a female? Not anymore, because now we have to take into consideration all those aspects that we were not taking the time to ask and see what that patient is. So where do you see that this CBI-M nomenclature will play a role in closing that gap when it comes to the treatment and the prognosis and improving the healthcare for females in general?
So why it matters is because we're going to have, with this new framework, more accurate diagnosis and more appropriate treatment, again, looking at those modifiers. So this term, if you've ever had a mild TBI can mean a couple hours of symptoms, or it could mean a couple of years of symptoms. A severe TBI could be a head-on car crash where you're in a coma for 2 or 3 days, even a week. You come out of that, and 2 weeks later, no problems. And I was at NIH when they were having the working groups meetings for this new nomenclature. And they had up a physician that had been a car accident, biker, hit by a car, was in a coma for 2 weeks, but was practicing about a month after that. Then they had people up there who had hit their heads, going under the coffee table for a napkin, coming back up, hitting their head, that were still having symptoms. So this mild, moderate, severe wasn't working for anyone. It wasn't working for the physicians, and it wasn't working for the patients, and it wasn't working for their families. So this new model, and I'm begging them to come up with some way of calling it something other than CBI-M, is not catchy, but it does include that clinical piece, that biomarker lab piece, yay, imaging piece, dash modifiers. So again, we're hoping that we're going to come up with a way to encapsulate it, and it could be called, Newton or something other than this. But what we're going to talk about are those modifiers. You guys are the biomarkers. It's going to be great, but we're talking about the modifiers. These are the sex differences, and I just wanted to go through this really quickly. The females had more prolonged symptoms, shorter recovery. Males had shorter recovery. Females, IPV, domestic violence and falls, especially in elderly women. Men, more sports, combats, and accidents and high-risk behaviors. I have 3 sons. We spent a lot of the time in the ER when they were younger. The females, the menstrual cycle outcome, the difference in TBIs, the higher rate of PTSD and anxiety. And they saw this in female soldiers, higher rates of PTSD. Well, it wasn't until they looked to the source of it, and most of the women TBIs in the military are from military sexual trauma. These are women that have been raped, and their TBI came through violence, which is part of why they were seeing the PTSD. And menstrual disruption and sexual dysfunction also included that was long-term fertility. And when I talk to lawyers, that's something I usually talk about with them, that if they are looking for a lawsuit from a woman that's injured with a brain injury, make sure they include in vitro and any kind of support if she hasn't had children yet. Include that in the demand for the overall amount they're asking for their lawsuit. So back to the modifiers, they play a key role in the recovery and outcome, and we have to consider them earlier and later in follow-up care. So some of the modifiers are pre-injury psychiatric disorders. I have ADHD. That was something that should be considered. Age. My profile when I was 20 would be different now at 58. Yeah, I guess 58 now. Postmenopausal. That's going to change. Education. I have a master's degree. I can use ChatGPT, which could be a benefit or not, depending. But I certainly know people that I can go to for medical care. And sex and gender. I am a cis woman. I genetically and also present as a white woman and can go and advocate for myself. So these are the modifiers that for me would be very different than somebody else. Some of the social differences, we talked about the male-funded, male-focused research. Social vulnerability. Once a woman has a brain injury, often she can be seen as kind of milking it for what it's worth. If we look at that 7 to 10 day as a normal runway for healing from a brain injury, that is for an NCAA Division I male athlete. Women, it's more like 3 to 6 months. If you look at women in your life that have had brain injury and you give them a 3 to 6 month runway of recovery, generally they will recover in that time frame. But within that time frame, they can lose jobs, they can lose friends, they could say, hey, my brother had a concussion, he was out of bed right away. Oh, and then mechanics of injury. So I'm just going to leave up the key takeaways, some of the things that we've talked about, because we definitely want to have time for some Q&A.
Great. Thank you so much. And yes, I think that right now it's a good moment to bring this presentation to the audience, and we are more than happy to answer some of the questions that you might have.
Thank you. That was a fantastic presentation. Can you hear me? Okay.
Yes.
So you had spoken quite a bit about concussions in women. I have an 11-year-old daughter. She's in sports. Can you expand a little bit on concussions in girls?
Yeah, definitely. Oh, this is weird. I'm going to have to take this off. Yeah, definitely. So the change comes along when the menstrual cycle starts. And there's really great research, Annie Lennox up in Canada, that shows that you don't see the difference in girls before they have their menstrual cycle. Now, if we look at earlier menstrual cycle now, it can be 8 to 9. So once the girl has her menstrual cycle, those are factors that be considered. So it's really important to know that. Now, in a lot of the studies I've done, the first concussion is usually 12 to 14 years old. So how that first concussion is managed makes a difference, because if they're like, well, people don't support me, I'm going to be quiet about this, or I get the care I need. So then when they go into high school sports, they already have sort of an attitude what it is. And again, girls don't play My Pretty Little Pony Gets a Concussion. I have 3 boys, and between Madden, between COD, all their video games, concussion is a part of their play. The boys know those terms. So another thing is education around girls.
Thank you.
Thank you so much for this very informative presentation. I'll be honest with you, I've heard a lot about TBI, but I was very surprised by the statistic you had there with all female, all women studies and how low it was. So my question for you is, what are some of the barriers that the researchers are experiencing when studying women?
Again, it comes down to funding. Who's going to fund this work? And I just want to say that Abbott has been so supportive of me. We're the only concussion organization in the world that focuses on women, and I was hoping by now I'd have some competition. But Abbott, you guys have been there helping fund me even through the concussion. There's no other organization that has supported me other than Abbott. Beth. Also, Beth shows up at my presentations. I was at the Super Bowl presenting at a brain injury conference. Beth pops up. I'm at the Hague. Beth pops up. She's everywhere. It's amazing. I'm always going to see her in the back. So again, it's funding. This doesn't seem important. From a military perspective, they know that they can do TBI research and have men come from their lives and come in and go to a 3 to 6 week program. Women soldiers that they found, women veterans, are so busy with childcare or caring for parents or jobs, they can do 2 weekends, 3 weeks apart. So some of the barriers are funding, some of the barriers are having access to women because they're doing so many different things. So it all comes down to funding. I want to thank Abbott for, not sure I would be here without the Abbott love.
Yeah, thank you. No, and actually, that is a very good question. So right now, by we, I mean Beth. She is working with this group of researchers in Australia and New Zealand when they just launched this extraordinary research effort where they're exactly doing that, focusing in the difference between men and women and actually highlighting and trying to reduce that gap of information that we currently have. So that is something that it is very important for us, because something that we always say, we cannot treat something that we do not see. And there's a lot to be learned, and that's what we're doing, and we are trying to do that, close that research gap that exists between men and women.
Yeah, and I would say women are the invisible patient within the invisible injury of brain injury.
Over 50% of the population, though.
Hello. Great presentation. I had a question about the CBI-M model. So it's a new framework or something like that, but when it comes to previous, years ago, if a person had a brain injury, does that apply to this model?
So this is a hard one because we've been posting in some of these patient groups. I have about 8,000 women on Facebook. Of course, they're all over age 25, and I haven't figured out how to really pull in the TikTok group. But that was the question that I got is, what about us? We already have a TBI. The framework hasn't been extended to people already with TBIs. It's acute and forwards, but they're looking on how to do that. But we're looking at lab tests that are acute at the time of injury and after the injury. But again, that's in the next decade where lab is going to be super important. Yeah. So stay tuned. Yeah. And this just rolled out in June.
Right. And actually, that is key because and that's where the M comes, right? So we have to take the time to learn more about the patient, their medical history. Because a lot of the times, we don't even ask if they had a previous TBI. And most importantly, we sometimes don't connect the dots that some of that symptomatology that the patient is letting us know might be related to a previous TBI that had never been diagnosed. So that is why it is key, and part of the research that we are also doing is looking at other biomarkers that could potentially help us answer all those questions in the subacute and chronic stages.
If no more questions, I'm going to tell my Abbott lab story. All right, I have 1 minute and 47 seconds. I was asked to go to New Zealand, paid expenses, so exciting to speak at their first national TBI conference. So we got down there, we walked 20,000 steps to keep awake the first day. The second day, my friend wanted to go bungee jumping. I'm like, no. She wanted to do black water caving. I'm like, no. We go to the zoo where I trip, fall, snap my wrist, and end up getting a concussion. So I end up in the Auckland ER, which my wrist is hanging off. I had osteoporosis, out of it now, but I had osteoporosis. So I'd snapped it before, but I really wanted them to attend to it. And they're so worried about my concussion, especially when I told the attending physician that I was here to do a talk on concussions. He's like, oh God, we can't screw this up. So they're so focused on getting me in a CT scan. I'm like, I don't want a CT scan. My hand is hanging here. We need to fix this. And I'm like, can you just do the Abbott lab test? Can you just do the Abbott concussion test? And he's like, what? I'm like, you don't have that? This is bedside testing. So I did a little sales pitch on the Abbott concussion test and using it why I didn't want to go into the CT scan. So I know Beth has been to Auckland since I was there, but I do want credit in at least working the Auckland City Hospital. So I hang around you guys, I act smart, you know? But that was an example where literally my hand wasn't connected to my wrist. So appreciate all you do, and the work in a lab gives us numbers that can change people's lives. The stuff that you do is so important, and I'm really excited to see what this next decade happens, what comes out, what new tests, and how we can use those to change diagnosis and patient outcome.
Thank you very much. Thank you, Catherine. Thank you for joining us.
On time.
Yeah.
I'll be around the rest of the day if anybody has any questions. Thank you so much for coming with all you have around.
Yeah. Thank you very much. Have a great day.